Now our next slide talks about our second learning outcome, the effect that endurance and aerobic training has on the cardiovascular system in terms of the benefits and the risks. So here we have benefits and here we have risks. Now, like the previous learning outcome, a lot of these will ring true in terms of the short and long-term effects that exercise has on the cardiovascular system. So try and put those to one side for now. We are now just purely discussing what effects aerobic training has on benefits and the risks to the cardiovascular system. So let's take benefits first. We have something called increased chemoreceptor sensitivity. This means that you are much more efficient at detecting changes within the blood of certain gases such as carbon dioxide and oxygen, which is very important. Obviously, if your main role of your cardiovascular system is to get oxygen to your muscles, for it to detect an increased level of CO2 will mean you will then increase breathing rate to get more oxygen in. The second benefit is your breathing muscles will get stronger, therefore increasing your respiratory capacity. You will use more alveoli, which are the small air sacs found within the lungs, which help to diffuse oxygen in and out of the blood. And your breathing rate will reduce at rest. These are all good things in terms of performing exercise. Another benefit is you will get left ventricle hypertrophy. Now this means that the left side of your heart will get stronger. Now if this happens, this means that blood can be pumped around the body at a much more forceful rate, which puts less stress on your system to get blood around the body. We will increase VO2 max, so your clients will start to get fitter in terms of their ability to uptake and utilize oxygen. You will increase the amount of red blood cells within the system, therefore increasing the amount of oxygen transportation throughout. We have an increase in a cell known as mitochondria, which help with ATP production. And as you remember, hopefully ATP is just another way of producing energy. Much more efficient gaseous exchange mechanisms, therefore getting oxygen to the muscles to produce energy. An increase in lactate threshold. This is where you can withstand greater intensities of exercise without having that feeling of shaky legs and feeling sick. As blood lactate increases, intensity will have to drop. Obviously, if you train regularly, the benefits of this is that you can increase your capacity. So you can increase capacity. An obvious decrease in the risk of hypokinetic diseases such as coronary heart disease. And not only from a physical point of view, you will also have much better mental benefits such as a sense of well-being, confidence, and things like that. Much more efficient energy utilization of fat and glycogen. And you will get an increased ability to help vasodilate your blood vessels, allowing more blood, oxygenated blood hopefully, to pass through your cardiovascular system and to make these blood vessels much more healthier in terms of their elasticity. So if a blood vessel can stretch and narrow and contract, then it's much more likely to help to regulate your blood pressure rather than a blood vessel that's very rigid. And last but not least, obviously with regular aerobic training and endurance training, the benefits of this is you will increase the strength of your muscles and all the connective tissues that your ligaments, tendons and muscles attach to. And now on to the risks. Now you might think that's rather strange, how aerobic training and endurance activities could actually cause a risk to your cardiovascular system, but there are some. We have an increased risk of stress fractures. You have to be very careful with some clients if they have osteoporosis or brittle bones, and if they suffer from osteoarthritis. Some clients who take part in ultra endurance events, which are very high intensity over long durations, may suffer from cardiac fatigue, myocardial damage, which is heart damage, which is an injury to the heart in some respects. If you're really pushing your heart to the maximum, it's not surprising, like any muscle would do, is strain. And the last muscle you want to strain in your body is your heart. So, things to consider there. Another one is abnormal growth. So, if you start really overtraining, and from a younger age as well, then you can actually start to affect the growth of your muscles and bones, such as damage to your growth plates. Overtraining can often cause reduced immune system functioning. So you'll find people suffer from colds, tiredness, fatigue, and injuries much more if they're overtraining. There will be an increased risk of hypoglycemia. This is low blood sugar levels. Obviously, the more you train, the more glycogen you'll use, and the more glycogen you use, the less blood will start to be present within the blood system. A good way of remembering hypoglycemia is it's low blood pressure, therefore the O in hypo stands for low. You'll have an increased risk of dehydration. Obviously, the more stress you put your body through in terms of endurance and aerobic activities, your electrolyte levels will decrease, you'll sweat more, you'll lose fluid, therefore there is an increased risk of dehydration. And as you probably can remember from level 2, this word DOMS, delayed onset of muscle soreness. Now, one risk is that obviously you will get DOMS, which will cause muscles to be sore and fatigued and painful. However, over time, regular training can reduce the effect of DOMS, which will also make it a benefit. So this now leads us on to our last learning outcome regarding blood pressure. And this leads us to define the different blood pressure classifications and also the risks of these different classifications. Now you can see here that we have three main types. We have hypotension, we have normal, and we also have hypertension. So those are your three main blood pressure classifications. Hypotension is often referred to as low blood pressure, and again this can be a way of remembering it with the O in hypertension. Now, we discussed systolic and diastolic blood pressure earlier. Remember, systolic blood pressure is the pressure of blood on the blood vessel walls when the heart contracts. Diastolic blood pressure is the pressure when the heart relaxes. So for this reason, you would always expect diastolic to be lower. Obviously, if you increase the blood pressure of something, the value will go up. So the systolic will always be the higher value. Now, in terms of hypotension, any score or any reading which is less than 90 over 60, you will see incidences or symptoms such as fainting, especially if you go from a seated to a standing position quickly. You might have felt this yourself sometimes when you go from standing to sitting or seated to standing very quickly. Dehydration can be a cause of hypertension, and also not eating, and also a feeling of dizziness. So these are all symptoms that you have to be aware of in your client if you notice them, that potentially they could suffer from low blood pressure. So moving on to a normal blood pressure reading. Now, a normal blood pressure reading would be anything around 120 over 80. Give or take 5 either side, then you should be fine. But this indicates a healthy cardiovascular system, which reduces the chances of stroke or myocardial infarction. Myocardial infarction is just another way of saying heart attack. And lastly, hypertension. Hypertension is a high reading. Now this can be treated in the UK with drugs such as beta blockers, but it does have more significance in terms of clients suffering from strokes or heart attacks. You do have to be very careful with a client with high blood pressure in what you get them to do in the gym. Now a reading of high blood pressure or a client who is hypertensive will be any reading that is 140 and above over 90 and above. So a reading of say 140 systolic over 90 diastolic would be hypertensive. Now if ever you found that you had a client with hypertension, you would definitely need to make sure that you sent them to the GP to make sure that they were safe to take part in an exercise program. And this is known as GP referral. Now, the health risks associated with high blood pressure, as we've said, are things like heart failure, sudden cardiac death, and heart arrhythmias, which is where your heart beats irregularly. You may have also heard of this thing here, heart failure. Now this is where your heart gets so overwhelmed it just simply begins to wear out and fail. Again, like any sort of overworked muscle, you will get damage to the muscle itself. Have a look down here and you will see other key risks: transient ischemic attack, a stroke, dementia, and kidney failure. These are all key risks associated with high blood pressure over time, which again you must be aware of. So that concludes the presentation surrounding blood pressure. Now this will allow you to complete the first section of your anatomy physiology workbook, which will detail the 3 learning outcomes we had on the coronary circulation and also the 3 learning outcomes on blood pressure. You may have questions and you will need to go onto the forum or email me with any issues you may have in order to complete these questions. Make sure that you look at the Moodle page for advice on web pages to visit to help you with any issues or questions you have surrounding this topic.